Hi, my name is Joy McLean. I'm Chief of the Family Health Division here at Kettering General Hospital. I'm here to say thank you. Thank you for the tremendous work that you've all put in over the past 12 months. And what a 12 months has been. We've seen us move our organisation around, move services from one area to another, but we've all continued to work very hard to deliver high quality and excellent patient care, giving the best possible experience to the population we serve. I want to say thank you to my teams within the Family Health Division, thank you to the medicine teams, thank you to the surgery teams, and thank you to the corporate services that have helped us carry on delivering that very important work.
My name's Lisa Hall. I'm actually here on behalf of the Family Health Division for the outpatients departments, just to say a big thank you to all the staff. We obviously haven't been on the front line during the COVID pandemic, but we have had a very challenging time throughout. What we've actually said is it's like the scene from Blackadder in World War I, where the troops are sent over the top, out of the trenches, not really knowing what they're going to be expecting and actually not knowing whether they're going to survive at the end of it. For some, it actually meant working and being moved to ward areas when some of our staff hadn't actually worked in a ward area for about at least 10 years. So obviously they found it very, very challenging and very frightening. For the staff that were left in the department, what it actually meant was a complete change of the ways we worked. The majority of the appointments were actually changed to telephone consultations. Although that sounds very easy, that in itself is very challenging and actually has a big impact on a lot of other areas, including appointment centre, medical records and the secretaries. So it's actually increased everybody's workload quite considerably. The patients that were being seen in the department were obviously very vulnerable. And so what this meant for the staff was that we had to make sure that we kept them safe. And obviously they weren't only vulnerable, but they're also very anxious. So we had this aspect to deal with as well. And a lot of the time they weren't actually even allowed into very difficult consultations with their relatives. So we were actually having to offer quite a lot of support to these patients. Moving forward, we've still delivering clinics in various areas, a lot of time where the environment is still very challenging. But I must say throughout all of this, the staff have been committed to any changes and they've always worked with a smile and hardly ever complained. So we'd just like to say a big thank you and keep up the good work.
Hello there, my name's Tess Page. I'm the lead nurse for the anticoagulation service at Kettering. Just wanted to inform you about our INR drive-through clinic that we've introduced in the service since COVID. Our patients require regular INR blood testing taken and the anticoagulation service needed to be very creative to work out how we could get these blood tests taken and keep the warfarin patients safe. Since April 2020, we have seen over 1,000 patients attend our INR drive-through, aka the burger van, and Kettering General was the first hospital to introduce an INR drive-through system, and I did receive lots of inquiries from various hospitals throughout the UK and over in Ireland asking how we introduce the service. Really proud of my team for the hard work that they have done to make the drive-through a success for Kettering General and most importantly our patients.
Hi, I'm Karen Dans. I'm the matron for the hematology and oncology service. Just wanted to let you know what our services have been doing during the COVID period. For our inpatients, we've developed holding bays so our patients still can be admitted to our inpatient ward. And for our outpatients, we have set up loads of nurse-led clinics, lots of two-stop clinics as well, so our patients can still be seen. During this time, we've also maintained over 85% of our pre-COVID capacity. So I would like to say thank you very much to all of our staff and include the whole trust. We're brilliant.
Hi, I'm Emma Mills. I'm the Divisional Head of Nursing for Pathology, Haematology, Oncology, Outpatients and Research. I would just like to say thank you to all of my teams for the work that you've done during COVID. It's not gone unnoticed, and there's some points that I'd like to say. So thank you to our pathology colleagues, and I'd like to say thank you to the phlebotomists who have really changed the way that they've worked during COVID. Thank you very much to our haematology and oncology services as well, including chemotherapy services that have managed to sustain treatments for patients during this time. And thank you to the anticoagulation and DVT service who have even managed to move services forward using a drive-through service to check patients' INR. Thank you also to my outpatients team. I know that COVID has really affected the way in which you work, but we've got some amazing developments to move forward with, embracing virtual. I'd also like to say thank you to our research team. You've been truly amazing sustaining research during this time, and also the additional COVID trials that have been bespoke and will undoubtedly benefit us all in the future. Finally, I'd like to say thank you to surgery and medicine and corporate divisions. We have done so much during COVID working together. We have also learnt so much, and we will be able to take our learning forward for the benefit of our patients.